Good day. So we are having a drug literature presentation and I will be presenting. My name is Leslie D. Manahan. So our today's topic is Montelukast, which is a generic name. Brand name, and the singular is the generic name. So we are going to discuss the action, what is Montelukast, how Montelukast works, indication, contradictions, precautions, adverse reactions, side effects, and as well as the nursing considerations. So our topic, Montelukast, as I said, which is the brand name, and the generic name is singular, and the pharmacological class is leukotriene receptors antagonist, or the LTRAS. So here, the answer of what is Montelukast. Montelukast helps to reduce inflammation and may be used to prevent asthma attacks in adults and children at least 2 years old. Montelukast is also used to prevent exercise-induced bronchoconstriction, which is a narrowing of the air passages in the lungs due to the exercise that is also known as exercise-induced asthma in adults and in children who are at least 6 years old. The action is it antagonizes the effects of leukotrienes, which mediate the following: airway edema, smooth muscles constriction, altered cellular activity. Results is decreased inflammatory process, which is part of asthma and allergic rhinitis. The therapeutic effects is decreased frequency and severity of acute asthma attacks, decreased severity of allergic rhinitis, and decreased attacks of exercise-induced bronchoconstriction. We have here the active and inactive ingredients of Montelukast. The active substance is Montelukast. Each tablet contains Montelukast sodium, which corresponds to 10 mg of Montelukast. The inactive ingredient is microcrystalline cellulose, lactose monohydrate, cross-caramelose sodium, and hydroxypropyl cellulose, and magnesium stearate. How Montelukast works? So we have here Montelukast inhibits specific receptors in the airways called cystenyl, leukotriene, and receptors specifically cystenyl leukotriene 1. These receptors are affected by substance called cystenyl leukotriene or LTDS, which are released during inflammation and following exposure to an allergen. By blocking these receptors, Montelukast inhibits the actions of LTD4 and prevents the development of edema, smooth muscle constriction, and inflammation. This relaxes the airway, relieves edema, and dampens down redness and irritation. For the indication, asthma indicated for prophylaxis and chronic treatment of asthma, 10 mg or single 10 mg tablet per RM every PM. Exercise-induced bronchospasm indicated for prevention of exercise-induced bronchoconstrictions, 10 mg per RM 2 hours before exercise. Do not take additional dose within 24 hours if taking Montelukast for another indication. And do not take additional dose to prevent exercise-induced bronchospasm. Allergic or perennial rhinitis indicated for symptomatic relief of seasonal or perennial allergic rhinitis. Again, a single 10 mg tablet per RM every day. Did you know the contradictions and precautions of Montelukast? Contradicted in patients with any previous sensitivity to Montelukast, of course, not used to treat acute asthma attacks and cannot substitute inhaled or oral corticosteroids, monitor for eosinophilia, vasculitic rash, worsening of pulmonary symptoms, and cardiac complication, and neuropathy. This medicine may increase certain white blood cells, or we call eosinophils, and may cause Churg-Strauss syndrome, blood vessel disease. This usually occurs in patients who have asthma or are taking oral steroid medicines that is being stopped or the dose is being reduced or lowered. Here we have the route, dosage, adverse effect, and interaction. Dose and route. Montelukast is an orally dosed drug available as a film-coated tablet, chewable tablet, or oral granules. Asthma, perennial seasonal allergic rhinitis, for oral once daily in the evening. So for the 1 to 6 years old, 4 milligrams, 6 to 15 years old, 5 milligrams, and 15 years old is 10 milligrams. The adverse effect in EENT, otitis, sinusitis. For the respiratory system, cough or rhinorrhea. For GI, abdominal pain, diarrhea, dyspepsia, nausea, increased liver enzymes. And neuro, tremor, and eosinophilic conditions including Churg-Strauss syndromes and fever. For the interaction, phenytoin, phenobarbital, and rifampicin co-administered with CYP3A4 inducers, plasma levels of Montelukast may be decreased. For the nursing consideration of administering Montelukast or singular assessment, be alert of signs of eosinophilic condition and allergic blood vessels reactions, including Churg-Strauss syndrome. Early signs include allergic rhinitis, sinusitis, asthma, or hay fever-like reactions. Symptoms can increase to include fever, skin rash, joint pain, severe pain, and numbness, peripheral neuropathy. Shortness of breath, coughing of blood, bloody urine, chest pain, arrhythmias, and GI problems such as diarrhea, nausea, vomiting, and GI bleeding. Notify physician immediately for further evaluation of any signs listed above. And then assess for pulmonary function at rest and during exercise to determine effectiveness of medication in controlling bronchoconstriction. Monitor and report any changes in mood or behavior, including anxiety, depression, suicidal thoughts. Monitor any muscle weakness or tremor. Report any neuromuscular problems that affect gait or other functional activities. For the intervention, when implementing airway clearance techniques or respiratory muscle training, attempt to intervene when the airway is maximally bronchodilated. Peak responses typically occurs 2 to 4 hours after oral administration. Patient-client related instruction. Advise patient not to exceed the recommended dose or frequency of administration. Contact physician if bronchospasm is not adequately controlled by the current medication regimen or if respiratory system continue to worsen. Instruct patient and family or caregivers to report other troublesome side effects including severe or prolonged headache, fever, cough, ear pain, sinus inflammation, nasal discharge, skin rash, or GI problems. We have nausea, diarrhea, indigestion, abdominal pain. So for the evaluation or the desired outcomes, prevention of and reduction in symptoms of asthma, decreased in severity of allergic rhinitis, prevention of exercise-induced bronchoconstriction. So the presentation will be end here, and these are the references. Thank you for listening.